blood relative to you. And this is important, especially if they had the problem before they were age 60. So if your 89-year-old grandmother has a problem, who knows what that was caused by? It could have been toxins or, some other habit they had. But if your 60-year-old relative has a problem and they're blood relative of yours, you have the genetic issue. It's the first question I asked Dennis that. First question I asked them, do you have a family history of heart problems? It's the first question because it's an easy one to ask. It's not an easy one to answer sometimes. So you have to do some homework. So today it's worth having some conversations. My uncle was sick at 55. What caused his illness? What happened to my cousin? Tell me. So just so you know what's going on. And if you look like that relative, it doesn't mean that you're better correlated, but some people think it does. So I always ask that as well, because it might remind you even more to ask the questions. And again, you're focused on people younger than 60 to 65 years of age. Now, how do you pick Dr. Right? What does the word doctor mean? It comes from the Latin. This is a Latin language. Doctore, teacher. The word doctor means teacher. We're supposed to teach, which means you're supposed to be the student. And if you're a good student, you go to school prepared with the questions that I asked you about. But how do you know if they're really good? Well, one little tip I'll give you is to ask the nurses, because they talk to all the doctors, and they see the doctors act with the patients. And they're the primary healers anyway of a society. Nurses are the ones in the front lines. So they have a pretty good idea if the doctor's really good for you or just okay for you. What hospitals does that doctor go to? It's a good way of gauging if it's a good hospital and if it's a good doctor. Are the partners of that doctor good? When you go into the office, do the patients there look like you? If everybody else in the office is 50 years different from you, it's not the right office for you. Find an office where people like you are going, right? And then this is really critical. Get your smartphone, hold it in your hand, and turn on record. And record the conversation. Now, doctors might get a little antsy when they do this. Tell them that you treasure what they're saying so much you don't want to forget anything. This is a big deal because you will forget half of what we say before you leave the door. Before you walk out of the room, half is forgotten already. You can do better than that. Record it and listen to it. In fact, bring a friend so they can take notes, because you're so nervous listening that you're going to forget certain things. This gives you the opportunity to get past that. Now, if you're doing this right, there are going to be times when you're going to have disagreements with your doctor. So tests are probably the best example. This is how you make sure your tests are being tested. Don't just get every test that's being asked. Tests are primarily logic questions. Don't think you're not smart enough to understand them. It's basic logic. For example, if I don't get the test, if I avoid the test, what happens? If they say nothing, don't get the test. You'll be surprised. Are there any alternatives? How accurate is this test? There's some tests that when you get them, it just creates more problems because it doesn't answer that many questions. So I don't bother with them. Is it painful? What kinds of complications? What's the ideal result? What do I want? And then if I get this test, am I going to have the surgery anyway? I mean, what other steps might be necessary afterwards? This whole story comes together and makes you begin to feel, my goodness, I can make this happen. So, just in the interest of time, pick out two last points. The most infected place in the hospital, what is it? The remote control. You know why? No one ever cleans it. Right? Everyone cleans the toilet. Everybody cleans the doors, the trays. No one cleans the remote control. So I always bring a little plastic bag and put it on top of the remote control and use it through there. It's just foolish things like that that cause infections. You would never imagine them. And, I'm sorry. Sorry, I want to get to this one. There we are. And then if you know your family ailments and you're focused on genetic problems, you reduce your risk factors like I talked about today, and you finally get the diagnosis relatively early because you don't run from tests that are really good like colonoscopies. Age 50, by the way, please. You get these colonoscopies and they say life-saving, it will change everything. Now I'm going to leave you with a video. Can I just, I'll get one slide. How much time do I have left? What time is it? I have 2 minutes left. Good, perfect, so I need. All right, so alternative therapies. I don't want to talk a lot about this, but I'm very passionate about this because I grew up in a culture, I spent a quarter of my childhood in Istanbul, Turkey, all over, and then most of my other life in the States. So I would see the world from two different places. And I realized that there were alternative ways of thinking about the world that still made sense. They weren't crazy. They might not have been what everyone else thought, but they still were worth thinking about. So alternative therapies became interesting to me. Chiropractics, acupuncture, massage, hypnosis, naturopathic treatments. That's why I started getting interested in supplements and the like. I wanted to understand how these work together. And I recognized